The first is, what is the diagnosis? Explain what's going on. Explain what a minor stroke is. Second is, explain what usual treatment is. What would be the usual thing you would do with a patient like the one in front of you? Thirdly, what is the proposed new treatment? What does that mean? What is the drug? What is the name of the drug, etc.? Fourth, what are the possible outcomes, including a discussion of what the adverse events would be. In this case, with a clot-busting medicine, we're talking about bleeding, and this needs to be explained clearly. It's important to emphasize that the risk appears to be very low, right? Otherwise, if you overemphasize adverse events, you're going to reduce the chance that the surrogate consent giver, in this case, is going to likely agree. Explain what are the normal alternatives to treatment. So it's important for people to realize that this is not their only choice. Explain that research is voluntary, and always voluntary, and continuously voluntary through the process of the trial. So whereas you get consent now, the consent process is a continuing process over the full 90-day period in Tempo 2. And if at 30 days something happens and the patient decides they don't want to participate, then you must allow that to happen. The seventh thing is to explain that patients may or may not benefit from being involved in a trial. In general, it's fair to do what I did in this tape, which is to say to patients that participation in research in general results in an overall increased probability of a good outcome. Now, that doesn't guarantee there's going to be a good outcome in this particular case, but it is true across multiple disciplines, and I think it's worth saying that. And the obvious reason is that patients get closer and better follow-up. You can emphasize the altruistic nature of this, which is the eighth point, that others may benefit in the future. And that's what we're trying to do, of course, is to change the standard of care. The last two things, the ninth thing, is to emphasize that patients get the best standard of care irrespective of whether they're in a trial or not. And so emphasize that the process of care continues as you would normally do at your hospital. And finally, to emphasize what is the consent document that you're going to ask the person to sign, and the point of it is really to document that you had a conversation, that you had a chance to explain the trial, and a chance for the consent giver to provide, to ask questions, to be able to explore what it really means. It does not waive their legal rights, and while the consent document can be used as a legal document in research but it's legally documenting what happened, not changing someone's rights, or it's not a contract from that perspective. So if you go through those 10 things, then you will have covered the most important principles of getting a consent from a patient, and you can achieve the balance of explaining that there's some risk, but you're also exposing and wanting the patient to benefit from this new therapy.